For the resident vet, today we are at Mobivet Veterinary Clinic in Lavington. We are going to meet Dr. Vanessa, who is going to give us tips on how we can control the populations in our pet animals, what happens to them, the procedure that is done, and how even to take care of them after the whole procedure. Welcome. Thank you so much, Daktari, for your time. Kindly introduce yourself.
My name is Dr. Vanessa MARITIM. I'm a BVM. That means I'm a veterinary surgeon. I treat dogs, cats, basically all domesticated animals. And I also run Mobivet Veterinary Clinic.
Probably tell us, why is it important to spay and neuter pets?
Mobivet, actually from the name, started as a mobile unit. So we'd go to people's homes on demand and treat their animals from there. Then there came a need to have a physical location for things like hospitalization and surgeries. So then we opened the physical clinic in Lavington roughly a year from today. That was February 2021. So between myself and Dr. Nick Langat.
And basically, what does the spaying procedure involve?
Spaying basically means removing the reproductive organs in an animal. That is the organ that holds the growing fetus and the organs that remove the hormones that support and sustain the pregnancy and the reproductive tract. So in this case, for males, we remove the testicles. For females, we remove the uterus and the ovary. So the biggest advantage and the biggest reason why people neuter their animals is to control population, because animals instinctively breed to increase their populations, and that's even from their wild nature, to make sure that whatever colony they're in survives stronger than the next colony. So the biggest advantage is to control breeding when you don't want to breed your pet. The second reason is to control behavior, because certain behaviors are, and mostly vices, are associated with reproductive hormones. For instance, in male dogs, they tend to mark their territory with urine. So that would be annoying, because most people now live with pets in their homes. There's also things like humping on objects, which can be quite uncomfortable in a setup where there's other people involved. Then there's also aggression, which is highly associated with testosterone. So that's two reasons. The other reason is also to prevent hormonal cancers. So there's certain tumors and cancers that are brought about because of the presence of certain hormones, like mammary tumors, testicular cancer, prostate cancer, and such. So that also helps, neutering also helps to prevent that.
And is there an appropriate age when the procedure is done, or instances when it cannot be done?
The best age to do surgery is just before they attain puberty, which is around 6 months for dogs and cats. Sometimes they come on heat, they become sexually mature a bit earlier because of maybe exposure to certain chemicals or in their diet especially. So the best time is once you notice your animal has come on heat, make sure they're spayed if you don't plan to breed them. If you're able to do it by 6 months, the better, because then you lower the chances of certain tumors in future. Sometimes an animal may not be fit for surgery for general reasons, like if they're unwell. We highly discourage neutering animals that are in season, female animals that are in season, because during that period, estrogen levels are high, so bleeding tends to become more rampant than when they're not on heat. And generally, any animal that's unwell or not fit for general anesthesia, we don't neuter.
An owner may be interested to know if there are complications or risks that are associated with spaying their pet. What do you say about that?
There's quite a number, and the most common would be because you're going into the abdominal cavity in the female dogs and the male dogs. In female dogs, female cats and male dogs, you tend to risk something called herniation. That's where the body wall breaks and somehow organs move from one body cavity either to the outside or to another body cavity. There's also excessive bleeding, as I had mentioned earlier, especially with animals that are on heat. And sometimes certain animals are genetically predisposed to to bleeding more than others. Sometimes you have infection post-surgery, which is normal even for human surgeries. Sometimes, regardless of what you do to make sure the room is aseptic and the procedure is aseptic, sometimes infection sets in. Sometimes they react really badly to anesthesia, certain animals, because once you put in anesthesia, certain organs, their functions are reduced. So that means the normal physiology is tampered with. So that could also happen during surgery.
Considering that spay and neuter can be fairly expensive, how can pet owners go about the cost?
It can be quite costly, to be honest, and it may not be possible for private vets to do free campaigns all the time. So one good option is that if you can afford it, you can start talking to your veterinarian as soon as you get your pet and start working towards it, because it's something you can foresee. So if you get a pet at maybe 1 month or 2 months, you can plan towards when they get to 6 months old. So you could talk to your personal vet, make sure that they guide you on what costs you will have to incur, and then work towards a payment plan.
And maybe, are there other alternatives for family planning apart from spaying and neutering pets?
For pets, it's either you neuter or you make sure they don't mate. So you either make sure that when your animal is in season, maybe lock them up or neuter them. There's no other, and sometimes we find people at call quacks giving family planning injections that I don't know where they come from, but they're actually not supposed to be used on animals. So the only method for population control in dogs and cats is to either neuter or prevent breeding. That's it.
Dr. Sharon Gige is a veterinary surgeon doing her internship from Mobivet Veterinary Clinic. Here is her experience so far.
I've been here, I've learned about basic surgeries, like as my superior has described, spay and neutering procedures like castration and neutering and others. So currently I'm learning many surgical skills, and as well as the different aspects that go into running a clinic, whether it's interacting with clients, buying pet food, medicine, and all other aspects.
Thank you so much, Daktari, for your time. And maybe before you go, what is your parting shot?
In an age where more people are living in very close contact with their pets, it's very important to educate yourself on what spay and neuter means. A lot of times you get questions on whether it's ethical or not, but a lot of research has been done to show that it's actually, the benefits outweigh whatever preconceived notion you have of what a domesticated animal living in close contact with people should be. Some people think it's unfair, but actually the only animals that mate for pleasure are actually humans and bonobo monkeys. Dogs and cats mate purely for reproduction. And the older they get, the more the risks involved with having reproductive hormones become. They don't live in the wild anymore, so they may not need it for protection as much as they did when they lived in the wild.
For the many pet lovers who have their animals, it is important that you spay your animals, not only for population control, but to make sure that the numbers you have in your homestead, you can be able to take care of them, feed them, or seek veterinary services for them, and basically give them a good life. Until next time, for the resident vet, I'm Dr. Paul Kangede.